Hi, everyone, and welcome to our panel today that's titled Economic Impacts of COVID-19 and State Responses. This is a panel discussion, and you'll have the opportunity to engage with both of our panelists. I'm going to introduce them, and then they're each going to speak for a while, and then we'll have a discussion. So I'm really pleased to be here and to hear about what is happening at the state level in Vermont and New Hampshire. Thank you both in advance. And I'll just introduce each of you. So we have Phil Sletten, who's a senior policy and analyst at the New Hampshire Fiscal Policy Institute, which is an independent nonprofit policy research organization in Concord, where he's worked since 2016. Phil researches New Hampshire budget and revenue policy, the economy, and the financial well-being of the state's residents and health policy. He previously served as a performance auditor for the New Hampshire Office of Legislative Budget Assistant, where he provided analysis to policymakers on a wide range of state agency operations. Phil has a Bachelor of Arts in Political Science and Policy Studies from Grinnell College and a Master of Public Affairs from the University of Wisconsin at Madison. He is also a graduate of the Leadership New Hampshire class of 2018. And we also have Kathy Davis. She is the president of the Lake Champlain Chamber, Vermont's largest business association. She leads the organization in its mission to create economic opportunity by celebrating business ownership, promoting a robust, diversified visitor economy, cultivating community leadership, and nurturing emerging talent. Prior to joining the chamber, Kathy worked for former US Senator James Jeffords. Kathy serves on the board of directors for both Hunger Free Vermont and the United Way of Northwest Vermont. She lives with her family in Jericho. So thank you both so much for being here. And I'm going to pass it on. I believe, Phil, you'll be starting. Okay, great.
Thank you, Dr. Santos. I really appreciate it, and I enjoyed your presentation as well. So thank you for setting up some of this further discussion that I think Kathy and I both have to provide quite well. So first, I want to talk a little bit about the economic impacts, particularly on vulnerable populations in New Hampshire. And when I say vulnerable, I'm really talking about financial and economic vulnerability. Some of those working families and families in poverty that, for example, Dr. Santos referred to in her presentation and described in her presentation. So first, when we're thinking about the economy, one of the important things to think about is what's happened with employment, what has happened with whether people are actually employed or engaged in the labor market. And this graph shows, just for New Hampshire, there are two lines here. One is the darker line of employed residents, and the other one's the labor force. So that darker line, one of the benefits of this time frame from 2006 to the most recent data that we have is that it shows what happened during the Great Recession, the recession from December 2007 to June 2009, which of course the effects of that lingered longer than that June 2009 timeframe, but the recession itself was during that time period. And you may remember in September and October of 2008, things were happening very quickly. We saw lots of job losses. There were lots of people's financial stability was shaken in a rather short period of time in the sort of most acute phase of that recession. And on the graph, you can see where there was a pretty significant decline in the number of employed residents in New Hampshire, the number of people that were telling the federal agencies that compile this data that they had a job or that they had lost their jobs. But that decline that we saw is nothing compared to the rapidity with which we saw this most recent impact from the COVID-19 crisis, a very dramatic drop both in speed and in scale. And that, we've seen a relatively quick rebound in the outset here. It appears to be slowing a little bit, but that's a positive sign that we've seen many jobs come back. Many more people say that they're employed as opposed to unemployed in New Hampshire. However, that is likely to slow over time, and we are still now just about maybe a little bit beyond the point of where we've gained the jobs back in New Hampshire up to the nadir after the recession. So there's still a lot of ground to make up on that front, even though the speed is encouraging. The one thing I do want to point out, though, is the orange line is the size of the labor force in New Hampshire. When I say labor force, what do I mean? I'm talking about the people who are employed and the people who are unemployed and actively looking for work. So these are people who would take a job if they had one, or they're looking for a job actively. And that number has dropped a fair bit and not recovered as quickly. And that suggests a lot of people are taking themselves out of the labor force. Now, it may be because they're in an at-risk population, at a health risk in particular to the 2019 novel coronavirus. There could be people who are performing childcare duties or caring for older adults who might otherwise be in different situations but now need care at home. So a lot of that labor force decline, we haven't seen as much of an increase yet. Now, these are still, so the early months of this, but what happens with that number is important, not just for the broader economy overall, but also for those individuals who presumably were earning income and engaged in the labor force before and have now had to forego that income. And that, for some people may be an easier choice than others, especially if we're talking about making ends meet. Now, we can quantify that economic impact of those job losses, especially those initial job losses, a little bit with some of the data that we have available. You'll see in the graph here, both New Hampshire and Vermont are about the same place when it comes to the percentage of adults who are reporting a loss of household employment income between March 13th and then this is the last week of the Census Bureau survey in mid-July. So the Census Bureau, has been surveying people to try and understand what's their economic situation, and this was the last week of that. This question was part of their questionnaire, and you can see that just under half of adults in both Vermont and New Hampshire reported a loss of household employment income between March 13th and that mid-July time period. Half of households is a relatively astounding number in terms of the widespread economic impact. And of course, this is household employment income. So we'll talk about some of the policies that may have helped support that. But that's a key thing to remember when we're thinking about how widespread this impact is. And it's been disproportionate, at least as best we can tell, on people who were earning less income before the pandemic struck. So US Federal Reserve Chairman Jerome Powell noted in May of this year that among people who were working in February, almost 40% of people in households making less than $40,000 a year had lost a job in March. And that's a pretty astounding number as well, that 40% of those low-income households had lost a job from February to March. And we see other impacts of these income losses that you might expect to see, including on food insecurity from other data sources. One survey from the University of Chicago found that in the 30 days covering roughly April and early May, about 22% of respondents ran out of food and did not have enough money to buy more. So that's how some of this income loss has been translated into people's sort of everyday lives and ability to make ends meet. Now, that's July-based data and early data in the pandemic. What about right now? What's the most recent data that we have, or at least more recent data? So looking in October in both New Hampshire and Vermont, this is a question from that same household pulse survey from the US Census Bureau. It's in a different phase now, so they're asking somewhat different questions in some cases. But basically, about a quarter of adults in each state report a difficulty paying for usual household expenses, and that the question prompts car payments and mortgages and rent and food. It gives a couple of examples, and we don't have baseline data to really understand the exact answer to this question from prior to the pandemic, but this is still a very significant portion of the adult population in both states that is saying that in the last 7 days, they experience some level of difficulty paying for these sort of usual household expenses. And that impact, especially that impact disproportionately on low income folks or folks who had limited assets coming into this pandemic, that's shown in, we can see that in other data as well. So this graph shows the unemployment compensation claims by industry in New Hampshire. And you can see the blue bar shows the level of those initial unemployment compensation claims. So this is someone claimed at some point who was working from this industry for unemployment compensation between March 15th and August 22nd. These are the eight industries that see the largest amount of unemployment compensation claims. And that blue bar goes down as you go from left to right on this graph. So, and the other bar, the green bar, shows what is the average weekly wage reported for those employees. And the line across the top, or across the middle of the graph, if you will, is the average wage for New Hampshire public and private sector workers in 2019. And you can see that all the way over on the left of the graph, food services and drinking places, right, is the name of the industry in the economic parlance categorization there. And you can see that's had the highest initial claims and is the lowest on this graph in terms of the average weekly wage that's paid. The healthcare and educational services also have seen a fairly significant impact. We can see across a couple different healthcare sectors, but also social assistance, personal laundry services, accommodation services. These are industries that people weren't making a lot of money going into this and have seen a fair number of job losses in this March 15th to August period in these data. We also see that in other data that's examining sort of more private sector, more rapid data collection that is from some private sector entities that collect information on employment. These data in particular are from the tracktherecovery.org, or the Opportunity Insights Economic Tracker, which is a project of Harvard University, Brown University, and the Bill and Melinda Gates Foundation. They are, again, sort of crunching these private sector data and synthesizing them to try and estimate of the jobs that were in existence in this case, New Hampshire, in January, and paid a certain amount the prior year, how many of those jobs have come back? And you can see that, for higher wage jobs in New Hampshire, it's actually maybe a little bit higher than it was in terms of the number of jobs available in January. For middle income jobs, they're about where they were before, but for lower income jobs, we see a pretty significant drop off still. A lot of those jobs have not come back. Now, this is measuring jobs, so it could be that a person who was working a low wage job is now working a middle wage job. But given the deficit that we see in the low wage job front, it's very likely that people who previously worked in low wage jobs have not been able to find a job that they're able to obtain in the period since the pandemic began. And if we look at the same data for Vermont, it's a similar picture. Everything's a little bit lower, all the numbers are a little bit lower. I don't know the exact reasons why. It could be that Vermont is has a slightly higher percentage of their population in food and accommodation services. Dr. Santos noted the healthcare and education industries. So there's probably the job mix is part of the difference in the job mix between these two states is part of the image here. But we can see that it's still for low wage employment, those jobs have come back the slowest, and indeed, like New Hampshire, appear to have stalled at a relatively low level compared to where they were just in January. So that suggests that a lot of workers who were previously low-income workers are still looking for work and not able to find it, because a lot of those jobs are the ones that haven't come back. And we can see some of this in our social safety net programs, our programs that are designed to help people in poverty or near poverty. A lot of those, for example, working families that Dr. Santos noted, that those people who may be near the income eligibility threshold for Medicaid before and then have lost a job are now eligible for Medicaid. And we've seen that in New Hampshire's Medicaid enrollment, that there are likely a lot of people who lost a job and are now trying to make ends meet in other ways, including being enrolled in Medicaid. Now there is a policy change here during the pandemic. The Medicaid disenrollments have not happened in the same way, so there's not necessarily the same monthly check on income. So that's likely part of this. At least some early data from Minnesota suggested that that was not the lion's share of this increase, at least in Minnesota's Medicaid enrollment, that most of it was because of people becoming income eligible. That's at least what those early data suggested. Either way, an increase from what we were seeing in the summer of 2019, where in New Hampshire, roughly 177,000 people were enrolled in Medicaid, to the most recent data showing 204,000 people enrolled. This is a very significant increase. Now, I noted some policy changes in Medicaid. There have been some really temporary policy measures that have been focused on supporting people with low incomes and people who are at or near poverty through this pandemic. At the federal level, we've seen additional unemployment compensation benefits, both the federal pandemic unemployment compensation of the additional $600 per week that lasted through near to the end of July. There's also been extended regular, if you will, level unemployment compensation benefits that are funded by the federal government, and expanded eligibility in terms of who is eligible for unemployment based on their job losses. The federal government also permitted the Supplemental Nutrition Assistance Program, or SNAP, or food stamps, permitted those benefits to go to the maximum level for everyone. Now, it used to be, I should say that the amount of the benefit has not increased, but for folks who were earning some income and weren't eligible for the maximum benefit, those individuals now are eligible for, or those households are now eligible for the maximum benefit amount. And SNAP is not important just for helping reduce food insecurity and helping people make ends meet, but it's also very effective economic stimulus. Also on the food front, I'll note that the pandemic unemployment benefit, the pandemic EBT program, that's focused on children who would have otherwise been in school and receiving free or reduced price school meals. That's another food assistance program that the federal government set up. The economic impact payments, which were the $1,200 checks per individual, obviously that was a one-time payment under current policy, but those did provide quite a bit of support, especially to people on the lower end of the income spectrum. There was also a moratorium on evictions for certain individuals between September 4th and the end of this year. That's from the Centers for Disease Control and Prevention. There are people on this call who know much more than I do about the interaction between housing and health, and financial stability, but that is obviously a key component when we're thinking about what are supports for people with limited incomes. And it's not for all individuals, and there are administrative hurdles, but that is a policy that exists today. And there's also the federal government provided coronavirus relief funds through the CARES Act to states to deploy in a sort of flexible manner to try and meet their needs that are associated with the pandemic. Both Vermont and New Hampshire, to my knowledge about Vermont, received $1.25 billion at the state level, which is the minimum that any state received without splitting it up between the local government of a certain size. Those dollars must be spent by December 30th of this year under current policy. And just a couple New Hampshire policies that we've seen as well was a moratorium on most evictions for a good portion of for all the second quarter of the year. There was also housing assistance grants that were targeted at folks who were having trouble making their housing payments. Also, additional support for unemployment compensation and initially expanded unemployment eligibility that still exists today, but the federal government has also expanded theirs as well. And also grants for local education, childcare, and public higher education, and grants to the New Hampshire Food Bank. Those are all policies that, again, many of those funded by those federal coronavirus relief funds that New Hampshire has implemented. But all of these I'll note that all of these are temporary policies in some way or another. Many of them have either already expired or were one time or are expiring soon. And that suggests that there may be additional needs out there, especially as we're seeing the pandemic become more prevalent again, and not seeing the same sort of temporary policies being put in place, at least at the federal level, in terms of targeted support for low and moderate income people at this time. Now, I mentioned looking forward, what we might be seeing in terms of economic supports for folks. Well, what might the recovery look like? Well, this is not an economic shock like other economic shocks that we've seen in recent past, so it's hard to say specifically. But looking at the last recovery, we can maybe learn some lessons from it and watch for some trends that could tell us how healthy and broad and equitable the economic recovery is. So here's a graph showing what essentially gross state product and gross national product, or gross domestic product, pardon me, how we typically measure the size of the economy. And you can see the light blue line is the United States, the dark blue line is New Hampshire, and New England as a whole as a remainder is in green. This is inflation adjusted. So the key takeaway here is that New Hampshire's economy grew a little bit more slowly than New England, the rest of New England and the United States as a whole originally, but then did catch up, and New England and New Hampshire a little bit more in line. But also that the size of the economy overall relative to prior to the Great Recession was larger, right? If you adjust for inflation, you're still talking about a larger economy. There's been economic growth in real terms over this long economic expansion, indeed the longest on record for the United States since we've started parsing through what is a recession and what is not. Now, that hasn't always translated into, and didn't appear to in this last recovery, translate directly into the same amount of income growth for households. So here you can see median household income in New Hampshire and the inflation adjustments in orange. And note, it doesn't start at zero, it starts at $50,000. So you can see the changes here. In 2006, 2007, the lead up to the last recession, we saw median household incomes growing, but then after that, during and after that recession, we saw household incomes fall and then remain stagnant for about half a decade. And it's only in the most recent half a decade of data that we have that we saw median household incomes get back to where they were at those pre-recession levels and where they were headed to right around the time the Great Recession hit. So that suggests that economic growth that we saw didn't necessarily translate directly into median household incomes in New Hampshire. Of course, when we're talking about median household incomes, we're talking about the middle. What's the distribution of incomes that people were earning? This is a completely, these data that you're seeing in front of you now, it's a completely different data set. And it shows the changes in wages by decile from 2004 to 2006 average to 2017 to 2019. And this is decile here being, if you look at the 10th percentile, that's 10% of wages were less than that. The 90th percentile, only 10% of wages were larger than that. The 50th percentile is the median wage. And you can see in green, those lower wages, basically in inflation adjusted real terms, they didn't grow between these two periods. So the last 3-year period before the last recession and the most recent 3-year period for which we have data before this recession. And so it's basically, there was no change in purchasing power if you compare those, whereas on the upper end of the income spectrum, there was a change in purchasing power. And
Phil, I'm going to ask you to wrap up in just about 1 minute. Sorry to interrupt. This is really amazing. I just want to make sure we have a chance for Kathy and questions. So, and then we can potentially come back to some more of yours.
Sure, absolutely. So keeping the colors the same, looking year on year, we can see that there's the decline in the green shows that people were not earning as much. People, especially with lower incomes who had consistently low incomes in this time, were not earning the same, were earning less in terms of real purchasing power. And to Dr. Santos's point about wealth, that decreased their ability to build wealth over this time period in this recovery from the recession until, again, the most recent years. And this isn't impacting everybody equally, right? There are disproportionate impacts on folks who may be less able to take advantage of the economic growth that we've seen in the economy during the recession. So this is 2014 to 2018 poverty estimates in New Hampshire. And remember, Dr. Santos's poverty levels, they're very low income levels. If you're a child, if you're an individual with a disability, if you're someone who identifies as something other than white and non-Hispanic, if you're born in another country, in New Hampshire, based on the data that we have, you're more likely to be in poverty. If you're in a family living situation that is, for example, a single female-headed household, or specifically for a single female-headed household with related children under 5, then, for example, for that last model of household, you're talking about a poverty rate where 1 in 3 households that fit that description are in poverty in New Hampshire, compared to a 5% poverty rate for all families. And for people living in non-family households, you're also talking about an elevated poverty rate. So we've seen that both the impacts of the pandemic have been disproportionate, and the recovery from the last recession also hasn't reached everyone in a broad, equitable, and potentially sustainable manner. So that could inform what we need to look for in the coming economic recovery. So thank you very much, and I'm happy to pass it back to Dr. Santos.
Thank you so much, Phil. There are a lot of really incredible stats that jumped out at me when you were presenting. And for folks who are listening, please feel free to send questions, comments, thoughts, anything you have into the chat. And we'll do a conversation after Kathy presents, because I think it'll be nice to sort of pause here, hear from Kathy, and then think about the region as a whole. So I'm going to pass it to Kathy next, and then we'll have a discussion towards the end.
Thank you, Dr. Santos. So as she mentioned, I'm Kathy Davis with the Lake Champlain Chamber, and it's my pleasure to be here with you this morning and give a look more at how things felt and looked in Vermont at the more personal level, as well as some of the policy changes that were enacted in Vermont with regard to this pandemic. I will say that the thing I try to keep front and center as we go about our work is that businesses and organizations were asked to close their doors, were asked to completely reinvent their way of doing business in the name of public health. And that hasn't occurred, at least previously in my lifetime. And we continue to see those measures in place as we try to gain control of the pandemic and preserve public health. So I like to sort of start out with that as the baseline for how we think of what assistance has been provided and how we look at the information as we go forward. So next slide, Phil, please. So in Vermont, we have seen that the service sector has been very hard hit. In Vermont specifically, tourism represents the second largest contribution of out-of-state dollars into Vermont's economy. And if we look back at March of this year, it was primarily tourism businesses that were asked to completely shutter their shops. So restaurants, hotels, bars were asked to close without any way, initially at least, of maintaining any income or employment. Virtually all industries in Vermont saw a reduction. That slide's wrong. Saw an increase in unemployment in the spring. So some examples of that would be that unemployment data from April year over year shows a 57% drop in employment for leisure and hospitality in Vermont. So that's an enormous change in employment levels for leisure and hospitality businesses from April 2019 compared to April 2020. If you look at the year-over-year employment data overall in April, every sector of Vermont's economy shows a drop, with the exception of government. So it was widespread loss of employment, obviously harder hit in certain sectors, but overall a widespread loss of employment. We continue to see, as Phil so ably demonstrated, we continue to see challenges for both the industries that I would consider restricted, meaning that there are still restrictions in place in terms of how they do business, but also other industries. And I'll give some examples. Recently, the governor of Vermont last week closed bars in Vermont as a continuing public health measure. Obviously, we will continue to see weaker employment from bars and nightclubs as we go forward, as well as events venues, arts venues, other businesses that really require gathering people in large places without social distancing. But we're also seeing impacts from industries like construction that are reliant on higher education, healthcare, or other businesses to drive their employment. And the concern there is that we will continue to see those industries be soft. So in speaking with some construction companies in Vermont, many of them are very worried about the amount of work and projects that they have lined up for between now and next summer. And they're very concerned that next summer that they will not have enough projects to keep their staffing levels the same. Another example I would give is manufacturers that are reliant on the industries that are most hard hit. So think of a manufacturer that is making something that supplies the restaurant industry. We know that restaurants have been hard hit, but they're also not buying the things that that manufacturer has created. So their employment will also be affected. And a company that I was recently speaking with that does supply the restaurant industry is only running at about 80% of their capacity. Meanwhile, there are other employers who have significant demand, especially those in food supply, but because of social distancing restrictions, they're not able to meet that demand, and they're not able to bring on additional employees because they physically can't fit them in their space. So some of this, we tend to think, as we should, about leisure and hospitality being so affected, but it is a broader impact, and we'll continue to see that broader impact. Additionally, in Vermont, and I'm sure it was the case in New Hampshire, businesses got very creative over the summer. We were able to really take advantage of outdoor recreation business activity, and businesses were able to change their model to take advantage of open air opportunities, whether it was retail or dining. As we head into winter, we all know that dining outside in Vermont or New Hampshire in the winter is not quite as much fun as in July or June. And so we are concerned that we will see a growth in unemployment as businesses are having to right-size their employment levels based on the income that they're seeing. Next slide, thank you. So what did it look like on a human level? This is a photo of Burlington, Vermont's Church Street, and it was empty in March. And today still, when I go into my office in Burlington, I would say probably a third of the parking spaces are occupied, and then the rest are empty. It still feels quiet, and we're not seeing the foot traffic to our businesses that we would normally see, especially as we head into the holiday season. We did though see some interesting pivots on the part of businesses that kept their doors open and kept their employees employed. For instance, there was a restaurant that sort of changed their business model and started selling groceries. As we all remember, you couldn't find yeast or flour in March and April, and a lot of other food products were scarce. And so this business was able to change their, start doing takeout, but then also using their relationships with food distributors, start to sort of sell on some of these products to their clienteles. Others were slower to pivot. Many restaurants, I think when we closed down, we all originally hoped that it would be sort of 6 weeks of a quiet period and then back to normal. We know that that didn't happen. And so you slowly saw, restaurants start doing takeout after a period. You saw to pivot, but because the shutdown was so had never been through before, the response was sort of mixed as we recovered. Next slide, please, Phil. So what did Vermont do in response? As Phil mentioned, we benefited from CARES CRF dollars, and a couple of the things I wanted to highlight. Vermont, the legislature and the governor worked to dedicate $30 million in housing assistance to those affected by COVID-19. 25 million of that went into rental assistance to ensure that people were able to remain housed. And then 5 million went into mortgage assistance for low-income homeowners. As in New Hampshire, in Vermont, we also suspended all non-emergency housing evictions until 30 days after the governor's emergency order. And of course, I think we all know that the interest in doing this is, especially when there is a stay home, stay safe order as there was in Vermont, it's that much more important that people are able to maintain their housing. Next slide. Vermont also used some of our CRF funding to do hazard pay grants, which right now is about $50 million. And these were grants that were made available to employers in certain sectors in order to then pass on a grant to their frontline employees. And this was really looking at the concept of those essential employees who remained working throughout the stay-at-home order, giving them an additional boost at using those CRF dollars to put more money into those folks' pockets. And it was a complement to the additional unemployment benefits that those who had lost their jobs were receiving. So we are just at the tail end of this in Vermont. There was additional money dedicated, and I believe the deadline for these grants was either earlier this week or sometime this week. Next slide. Thank you. In terms of business and what Vermont did, this slide is already, I just produced this slide and it's already out of date because on Saturday, Vermont's Joint Fiscal Committee dedicated another $75 million in business grants. So we have almost $300 million that have gone out to businesses and nonprofits in terms of economic recovery grants. So these grants are capped at approximately $300,000 per entity, and they're designed to help cover some of the losses that organizations and businesses experienced between March and September. To give sort of a scale, the most recent grant applications, applicants were asked to demonstrate their total need in terms of how much lost revenue they had experienced. The application need totaled about $680 million. And with the current pot of money, we'll be able to cover about $150 million of that. So that demonstrates that there's an enormous need still in the business community in terms of their losses compared to any aid that they've received either from the federal programs or this federally funded state program. Vermont also used some of that CRF funding to do technical assistance to businesses. And that was for things such as purchasing safety equipment, plexiglass barriers, but also assistance in terms of how to change your business model, or even something as specific as bringing in an architect to a restaurant to help redesign your restaurant layout in order to accommodate social distancing. They also provided grants to specific industries. So there were grants for agricultural businesses, grants to minority and women-owned businesses, as well as other sectors that had specific needs. And then early on during the initial shutdown, we halted the collection and penalties on trust taxes, meaning that a business like a retail entity that collects the sales tax and passes it on to the state of Vermont, the state halted the collection of those taxes from the businesses, allowing them to maintain that funding for a period, and then didn't charge penalties on paying those taxes late. And it was really instrumental in helping some of those businesses maintain some cash flow while they figured things out and navigated the closures. So this is a slide that just shows where Vermont's CRF funding has been distributed. And again, that 238 million up at the top, we'll pretend that we're adding 75 million to that. But generally that's what it looks like. And then you'll see how much states got in terms of CRF funding. You can see that Vermont really capitalized on that, given our small size and those lovely state minimums. Next slide. So what does it all mean? As we all know, 2020 is a year of uncertainty, and there is a lot of uncertainty going forward, unfortunately. Like I said, winter is expected to be tough, and hospitality, retail, arts, and events are likely to continue to struggle, as will a broader array of businesses that are impacted by those other sectors. Next slide. But there's some hope for the future. You know, amidst all of this, we saw in this country incredible shift in terms of paying attention to structural racism and working to become anti-racist. And so in the middle of the pandemic, the city of Burlington declared racism a public health emergency. And what was unique about that, in addition to just the concept, is that it was a banding together of nonprofit organizations, the city organizations like ours, who committed to not only make this declaration, but work together to solve these challenges from an economic perspective, and then as well as how it infiltrates everything in our daily lives. So there are some bright spots that come out of 2020 in the sense that we had opportunities to improve. Generally, if we can survive this, we might thrive. As we know, many brick and mortar retailers and other industries had challenges before we went into this pandemic and the ensuing challenges. They might end up coming out of this looking differently, and that might look better. We might see more automation, which unfortunately will change employment. But it might also give us an opportunity, given our historically low unemployment rates prior to this, to get folks into different careers that will have a better outcome, both for the economy and their personal finances. The other thing is that we in Vermont were able to use some of the CRF dollars for long-term projects. So for instance, $34 million of our funding was devoted to new housing creation, as well as housing for homeless individuals. And we also were able to dedicate $8 million in funding to landlords to rehabilitate housing stock. So the legislature and the governor had the foresight to sort of look creatively at those dollars and figure out how we could make Vermont stronger in the interim, but also for the long term and some of the challenges that we've had. And then I would not be a local Chamber of Commerce person if I did not make an impassioned plea for everyone to buy local. Now, this holiday season and this winter, if the businesses that make up your downtowns and your regions, they really need your support. When you think about going into town, you think of the businesses that it wouldn't feel the same if they weren't there. So please support them and consider, making your holiday purchases with local businesses that are investing in your fellow residents as well as your communities. Thank you.
Thank you, Kathy, and especially thank you for ending on that positive note. It's really exciting to hear about all of the policies that both, New Hampshire and Vermont have been putting in place, some coming from the federal government and some being interpreted or supplemented or sort of designed on a local scale, and incredibly thinking about the long term, right? Because we know that the effects of COVID on the economies of both Vermont and New Hampshire will be long term. And so I love the examples of sort of the ways in which policy can help us survive and thrive over the long term. So thank you so much for that. I do have one question here that came in earlier. And as we start this conversation, I'd love to encourage folks to submit additional questions or comments to either Phil or Kathy. And I have a ton of questions, so if none come in, we'll have a great conversation either way. But so a question for you, Phil. Gail Tudor asked, can you expand upon the no change in purchasing power for the lower incomes?
Right. So based on what we know about people's wages, like the wage broken down into what's the number of hours you work, what's the amount of income you earn. That is part of one of the surveys that the federal government conducts each year, or part of one that's conducted each month, actually, I should say. And those data show, if you adjust for inflation, for people who are earning the median incomes or less, if you compare the period immediately prior to the last recession to the immediate period immediately prior to this one, then those wages, not only did they not keep up with inflation, but for a fairly significant period, for about half a decade following the last recession, for the 10th and 20th percentile of workers, so those who are making lower wages in terms of the spectrum, for the 10th and 20th percentile wages, those were lower than what the inflation adjusted value of the dollar, right? So that means that relative to, and this is an inflation adjustment based on what the consumer price index urban is. So that's basically what's a basket of goods, right? A collection of goods that people are that people usually purchase, right? How has that price trended? How has the cost of that trended over time? And we saw in New Hampshire that quite a few people, well, the lower end wages fell behind the cost increases of that collection of goods. Now that means that there are people who previously would have been able to afford that collection of goods without a problem, now are facing higher costs relative to what their incomes were. And that was, again, for a fairly long period of time, which means that it was harder to make ends meet, if you will, for about half a decade following the recession. It was only when New Hampshire hit a less than 3% unemployment rate that we saw wages, especially at the low end of the income spectrum, start to rise again, and rise significantly relative to what we saw inflation being. So it made it essentially so that purchasing power was reduced for a fairly long period. And it wasn't until really there was a lot of a lack of slack in the labor market that those wages started to go up, which makes sense from a supply and demand perspective, but also does suggest that the economic growth that was happening during that period immediately after the recession wasn't reaching folks as nearly as robustly at the low end of the income spectrum.
Perfect. Thanks, Phil. And we have a question about housing. So Richard Menard asked, Kathy's point about Vermont investing in new housing with that CRF money is interesting. Has New Hampshire done anything comparable? And I don't know, Phil, both specifically about housing, but I'm also curious about any innovative investments that New Hampshire has made with their CRF money for the long term in addition to housing.
Sure. So there were those housing assistance grants, but a little longer term, the most recent state budget, the one that we're currently still operating under in New Hampshire, our 2-year budget, did dedicate funding for the first time in a dedicated revenue stream to what's called the Affordable Housing Fund, which does help with the creation of more housing in the state, especially targeted at people who may be less likely to be able to afford some of the existing housing stock or some of the stock that's typically developed in the course of the private economy working without that sort of subsidy. So there is some of that investment. That is, it's not a particularly large investment relative to the size of the problem. In New Hampshire, the vacancy rate for apartments for 2-bedroom apartments has been quite low for some time. I think in the most recent data, it was about 2%, relative to the comparable data is about 7% nationwide, and it's higher in other New England states as well. So that low vacancy rate, and combined with the increasing prices that we've seen both in the rental market and in the housing market, or the market for purchased homes, makes it very difficult for a lot of people to afford housing. And Dr. Santos, you showed nearly half of renters in New Hampshire and in Vermont and nationwide, about half, are paying more than 30% of their income in rent, which is that sort of rule of thumb benchmark for being cost burdened, if you will. So there's a pretty profound challenge on that front. New Hampshire has made some long-term investments, and relative to the coronavirus relief funds, there were quite a bit. The plurality of them did go to business aid as well, aid for particularly for smaller businesses. But in terms of the other creative pieces, I would say that there was a large amount of funding devoted to improving broadband infrastructure, which is something that could pay dividends over time. Some of those dollars didn't get used and were reallocated, but some of them were deployed. And there were other, some of the investments in education. I did flag those as something that's, may have long-term benefits, although some of those dollars were devoted to just pandemic-related costs, which is part of the restriction of those coronavirus relief dollars. So those are things that I would mention as some of the innovative solutions.
Great. Thank you both so much. I'm being told we're at time, so I know there are some other questions that are coming in that we'll make sure to have the panelists answer through the organizers later on. But thank you both so much. And I see this as a real opportunity for states to learn from each other, Vermont and New Hampshire being close neighbors, and there's really exciting stuff going on in both states, and thanks for sharing.
Thank you.